a good example, comprehensive, that shows how the system can be used in different areas of the patient journey is a system we use right now, an application we use in primary healthcare, and particularly in prevention of cardiovascular diseases like myocardial infarctions, strokes, and so on. So I'll try to describe the system a little bit because it's a very revolutionary and fantastic system. So we have a population of patients that they might not have well controlled their cholesterol or the lipids, as we call them, and because of that, they have a high risk of developing a stroke or a myocardial infarction, very, very high risk of death or bad quality of life after this. And those patients could reduce very much that risk, almost to zero, if they were treated properly, either conservatively sometimes or with the appropriate medication. And so we are partnering with a lot of general practices. We're still on rolling it out. And so our system will do three things. The first one is it can run on all the patient data of the practice, or the practice we have. We're talking here about 200,000 patients. And it could be running all the time in the background, overnight, analyzing the patient data, applying its rules and applying its clinical logic to identify patients that are not treated very well, and they could benefit from this reduction of their cholesterol and other lipids. It can identify those patients and prioritize and prepare a list to give to the staff to call them and review them further. The other thing is that it can do that on demand. So when you go to visit your GP and they bring your patient record in the system, our system scans in the background, applies its clinical logic, communicates with a health record system that the GP uses, gets your data, and it can even do it anonymously without even knowing who you are, and it can identify if you were at risk and therefore you could benefit from a treatment. Pops up a notification to the doctor telling them that this is a person that would benefit from this thing, and then just with a click of a button they can bring all the clinical decision support with the recommendations, what's the medication that is recommended, how much is the risk reduction, and the doctor can read it's the context, where the source it is, etc. Therefore they can treat you and prescribe you and put you in the program to reduce that risk. So these are the three things. It's identification of the population on demand when somebody visits or their patient record is open, and then treatment planning and prescription. And then once you're in the treatment planning, the system will manage how frequent you need to be visiting, review your results, and adjust the treatment. And this is done technically. It's done by integrating on the background the two systems, the electronic medical record. We have integration with all the we're progressing to all the medical record providers. We have two at the moment, and it's done transparently, so it doesn't require extra effort from the doctors, with a huge benefit potentially.